7 fruits that actually heal your kidneys. Right now, while you're sitting there watching this video, your kidneys are filtering your blood, all of it, about 50 gallons every single day. And here's what terrifies most doctors. By the time you feel something is wrong, you may have already lost 50 to 60% of your kidney function. Silent. No pain, no obvious warning signs. But here's the good news, and this is what I want you to stay for. Your grocery store is stocked right now with fruits that clinical research has directly linked to slowing, and in some cases partially reversing, kidney damage. I'm going to walk you through all 7 of them today, tell you exactly how much to eat, when to eat it, and, just as importantly, what mistakes most people make with each one that cancel out the benefits entirely. Stay with me. This could genuinely change the trajectory of your health. Welcome back, and if you're new here, this channel is dedicated to giving you science-backed, practical health information that you can actually use in real life. No fluff, no selling you supplements at the end. Just research, real food, and honest advice. Today's topic is kidney health, and I want to approach this differently than most videos out there, which tend to either scare you to death or make promises that sound too good to be true. Here's what I can promise you. I've gone through the peer-reviewed research on each of these 7 fruits, and I'm going to walk you through the real mechanisms, what these foods actually do inside your kidneys at a cellular level, and what the clinical evidence actually says. One important note before we dive in: if you have been diagnosed with chronic kidney disease, especially stage 3, 4, or 5, please consult your nephrologist or registered dietitian before making major dietary changes. Some of the nutrients in these fruits, like potassium, need to be managed carefully in advanced kidney disease. I'll flag that for each fruit. Okay, let's get into it. Kidney basics. Before we talk about the fruits, I want to spend 2 minutes making sure you understand why your kidneys matter so much. Because honestly, most people don't think about their kidneys until something goes wrong. Your kidneys, you have 2 of them, each about the size of your fist, sit just below your rib cage on either side of your spine. Every single minute, about 1 liter of blood passes through them. They filter out waste products, excess minerals, and fluids, and return clean blood back to your body. They also regulate your blood pressure, balance your electrolytes, produce hormones that stimulate red blood cell production, and activate vitamin D for bone health. In short, they're doing a lot. The filtering units inside your kidneys are called nephrons, and each kidney has about 1 million of them. Here's the scary part. Nephrons don't regenerate. Once they're damaged or destroyed, they're gone. Chronic kidney disease is what happens when nephrons are progressively lost, usually from diabetes, high blood pressure, or chronic inflammation, over months and years. Now, the reason diet matters so enormously: everything you eat and drink either protects your nephrons from damage or accelerates their destruction. Oxidative stress, inflammation, high blood sugar, high blood pressure, all of these are modifiable, meaning you have real control over them through what you eat. And the 7 fruits we're about to discuss directly target those mechanisms. Let's go. Fruit number 1, cranberries. Number 1 on our list is the cranberry, and I want to start here because cranberries offer a kind of kidney protection that most people don't even know they need: infection prevention. Here's the connection that most people miss. Your kidneys and your urinary tract are part of the same system. Bacteria that enter the urinary tract can travel upward, past the bladder, through the ureters, all the way to the kidneys, causing a kidney infection called pyelonephritis. These infections can cause permanent, irreversible damage to kidney tissue, and they're especially common in women and in older adults. So preventing those infections is actually a frontline kidney protection strategy. Cranberries contain a class of compounds called type A proanthocyanins, or PACs. What makes these special is that they prevent E. coli, the bacteria responsible for about 85% of urinary tract infections, from adhering to the walls of the urinary tract. The bacteria literally can't grip the surface. They get flushed out before they can establish an infection. A 2012 meta-analysis published in the Archives of Internal Medicine reviewed 24 studies and found that cranberry consumption reduced UTI risk by approximately 35% in women with recurrent infections. Beyond infection prevention, cranberries are rich in flavonoids and phenolic acids, powerful antioxidants that protect kidney cells from oxidative stress. And they have real anti-inflammatory properties, which, as we'll talk about throughout this video, is central to slowing kidney disease progression. The big mistake people make: drinking cranberry juice cocktail. Most commercial cranberry juices are only 25 to 30% cranberry. The rest is water and added sugar. That sugar is actually harmful to your kidneys. You want fresh cranberries, frozen cranberries, or 100% unsweetened pure cranberry juice, diluted in water if needed. How much? About 1 cup of fresh or frozen cranberries per day, or 4 to 8 ounces of pure, unsweetened cranberry juice, diluted in water. Caution: if you take warfarin, a blood thinner, discuss cranberry intake with your doctor. There's a documented interaction. Fruit number 2, watermelon. Watermelon. You probably think of this as a summer treat, not a kidney medicine. But there are 2 compounds in watermelon that are genuinely impressive for kidney health. The first is L-Citrulline. Watermelon is the richest dietary source of this amino acid on the planet. Here's why that matters. L-Citrulline is converted in your body to L-arginine, which your body uses to produce nitric oxide, a molecule that causes your blood vessels to relax and dilate. Why does that matter for kidneys? Because your kidneys receive about 20% of your heart's total output. They need excellent blood flow to function. When blood flow is restricted from high blood pressure, atherosclerosis, or diabetes, kidney tissue becomes ischemic, meaning starved of oxygen. That accelerates damage. The citrulline in watermelon supports better circulation to your kidneys. Some animal model research has even found citrulline protective against ischemic kidney injury specifically. The second compound is lycopene, the antioxidant pigment that gives watermelon its red color. Lycopene is a fat-soluble carotenoid that has been associated in epidemiological studies with slower kidney disease progression. Watermelon is also 92% water, making it one of the most hydrating foods you can eat. Chronic low-level dehydration is under-recognized as a driver of kidney stress, especially in older adults. Eating watermelon is an easy, pleasant way to increase your daily fluid intake. The big mistake: juicing watermelon and drinking large quantities. The natural sugars concentrate fast. Eat it as whole fruit in moderation. How much? 1 to 2 cups of fresh watermelon daily. The white rind near the peel actually contains the highest concentration of citrulline. You can blend it into smoothies. Caution: if your doctor has placed you on a fluid restriction or strict low-potassium diet, common in stage 4 to 5 CKD, check with them before eating large amounts. Fruit number 3, blueberries. If I could only pick one fruit to tell you about today, it would be blueberries. The research on blueberries and kidney health is genuinely impressive, and the reason comes down to anthocyanins. Anthocyanins are the pigments that give blueberries their deep blue-purple color. They are among the most potent antioxidants found in any food, and they have 3 properties that are directly relevant to kidney health. 1. Antioxidant protection. Your kidneys are particularly vulnerable to oxidative stress because of the sheer volume of filtration they perform. Free radical damage to nephron cells is a primary mechanism of chronic kidney disease. Anthocyanins directly neutralize free radicals and upregulate your body's own antioxidant enzyme systems, including superoxide dismutase and catalase. 2. Anti-inflammation. Blueberry anthocyanins reduce levels of inflammatory cytokines, including IL-6, TNF-alpha, and CRP, all of which are elevated in chronic kidney disease and directly drive its progression. A 2010 study published in the Journal of Agricultural and Food Chemistry found that blueberry supplementation significantly reduced inflammatory markers in obese subjects. 3. Blood sugar regulation. Diabetes is the #1 cause of kidney failure worldwide. Blueberries improve insulin sensitivity and slow glucose absorption through the GLUT4 transporter pathway. This means eating blueberries regularly helps protect your kidneys from the damage that chronically elevated blood sugar causes. Blueberries also happen to be one of the lowest potassium fruits available, about 115 milligrams per cup. This makes them one of the only fruits safe for people, even with moderate to advanced CKD. How much? At least 1 cup per day, fresh or frozen. Frozen blueberries are equally nutritious and available year-round. No significant cautions. Blueberries are safe for nearly everyone, including people on most common medications. Fruit number 4. Apples. An apple a day keeps the nephrologist away. I know, but in this case there's actually some real science behind it. Apples protect your kidneys through a mechanism that most people have never heard of: gut-based toxin removal. Here's how it works. Your gut and your kidneys are connected through what researchers now call the gut-kidney axis. When your gut microbiome is healthy and your digestive function is working well, many waste products and toxins are captured and eliminated through your stool before your kidneys ever have to filter them. Apples are rich in pectin, a type of soluble fiber that forms a gel inside your digestive tract. This gel binds to toxins, heavy metals, and uremic waste compounds, including things like indoxyl sulfate and P-cresol, which are toxic byproducts of protein digestion that accumulate in chronic kidney disease and damage kidney tissue further. By binding these toxins in the gut and eliminating them through stool, pectin actively reduces the toxic load your kidneys must handle. A 2014 study found that pectin supplementation significantly reduced blood levels of uremic toxins in CKD patients. Apples are also rich in quercetin, a flavonoid with documented anti-inflammatory and antioxidant properties. Quercetin has been shown in cell studies to directly protect kidney cells from oxidative damage. The big mistake: peeling the apple. The peel contains the majority of the fiber and the majority of the antioxidants. Eat the whole apple, washed well, peel on. How much? 1 to 2 medium apples per day. Apples are naturally low in potassium, approximately 195 milligrams each, and appropriate for virtually all kidney disease stages. Fruit number 5. Lemons. Lemons are on this list for a very specific reason: kidney stone prevention. If you've ever had a kidney stone, you know it's described as some of the worst pain a human being can experience. And once you've had one, your risk of having another increases significantly. Here's what makes lemons special. They are extraordinarily rich in citric acid, specifically citrate. Citrate is one of the most powerful natural inhibitors of kidney stone formation, and it works through 3 mechanisms simultaneously. First, citrate binds to calcium in the urine. Calcium oxalate stones, which are the most common type, form when calcium and oxalate bind together and crystallize. Citrate captures the calcium before it can bind to oxalate. No binding, no stone. Second, citrate raises urinary pH, making the urine less acidic. Stone formation is favored in acidic environments. By alkalinizing the urine slightly, citrate makes the environment hostile to crystal formation. Third, citrate can actually dissolve early-stage crystals before they grow large enough to cause problems. A landmark clinical study published in the Journal of Urology found that lemonade therapy, drinking the juice of 2 lemons in 2 liters of water per day, increased urinary citrate levels, and reduced stone formation rates significantly over a 4-year period. The target citrate dose for stone prevention is 4 to 6 grams per day. One lemon contains roughly 1.5 to 2 grams of citrate, so the juice of 2 to 3 lemons per day in water covers you. Tooth enamel note: always dilute. Drink through a straw if possible. Rinse with water after. Wait 30 minutes before brushing. These precautions eliminate the enamel risk. How much? Juice of 1 to 3 lemons per day, diluted in 16 to 32 ounces of water. Very low in potassium, appropriate for all kidney disease stages. Fruit number 6, strawberries. Strawberries, sweet, delicious, widely available, and seriously underrated when it comes to kidney protection. 1 cup of strawberries delivers 85 to 100 milligrams of vitamin C, more than your full daily requirement. And vitamin C, when consumed through whole food rather than supplements, is a potent antioxidant that directly protects kidney cell membranes from lipid peroxidation, one of the primary types of oxidative damage in CKD. But the compound I really want to highlight in strawberries is ellagic acid, a polyphenol that has been studied specifically for kidney protective properties. Ellagic acid is converted by gut bacteria into compounds called urolithins. And urolithins have demonstrated in research the ability to reduce inflammation, specifically in kidney tissue, reduce markers of fibrosis, which is the scarring that reduces kidney function, and protect kidney structure under conditions of oxidative stress. Strawberries also help with blood pressure regulation. Large epidemiological studies, including the Predimed study, have found that regular berry consumption is associated with meaningful reductions in systolic blood pressure. Since high blood pressure is the second leading cause of kidney disease, this cardiovascular benefit is also a kidney benefit. Pesticide alert. Strawberries consistently rank in the top 3 on the Environmental Working Group's Dirty Dozen pesticide list. Buy organic if at all possible. If not, wash conventional strawberries thoroughly. A brief soak in diluted white vinegar solution, followed by a rinse, has been shown to remove surface pesticide residue. How much? 1 cup at least 3 to 4 times per week. About 230 milligrams potassium per cup. Moderate, and fine for most CKD stages, unless you have strict restrictions. Fruit number 7, pineapple. Number 7 is pineapple, and it makes this list for a reason no other fruit can claim: bromelain. Bromelain is a complex of proteolytic enzymes, meaning enzymes that digest protein, found predominantly in the core and stem of the pineapple, and it has been studied for its anti-inflammatory properties for decades. Here's why this is relevant for kidneys. Inflammation in kidney tissue triggers a cascade. Immune cells infiltrate the glomeruli, scar tissue forms, functional nephrons are destroyed. Bromelain has been shown in research to inhibit the production of pro-inflammatory prostaglandins and cytokines, and to modulate the NF-kappa B inflammatory pathway, one of the master switches for inflammation in the body. Some animal research has specifically examined bromelain's effect on kidney inflammation, with promising results for reducing inflammatory infiltration in kidney tissue. Pineapple is also an exceptional source of vitamin C, about 80 milligrams per cup, and manganese, a trace mineral involved in the function of antioxidant enzymes like manganese superoxide dismutase, which protects kidney mitochondria from oxidative damage. The big mistake: eating only the flesh and discarding the core. The core contains the highest concentration of bromelain. Blend the core into smoothies, you won't taste the difference. Caution: bromelain has mild anticoagulant properties. If you take blood thinners, check with your doctor before eating large amounts. How much? 1 cup of fresh pineapple, 2 to 3 times per week. About 180 milligrams potassium per cup. Moderate and appropriate for most stages. Bonus tips: what to avoid. Now I want to spend 2 minutes on something most videos leave out, the mistakes that cancel out everything you just learned. 1. Excess sodium. Salt makes your kidneys work harder. High sodium intake raises blood pressure and increases urinary protein loss, both of which damage kidney tissue. The American Heart Association recommends under 2,300 milligrams per day for CKD patients under 1,500 milligrams. This is probably the single highest impact dietary change most people can make. 2. Processed fructose, not fruit, added sugar. The fructose naturally present in whole fruit, consumed alongside fiber, is processed very differently than the high fructose corn syrup in processed foods. The latter raises uric acid levels, promotes inflammation, and directly stresses kidney tubules. Avoid processed sugar, not whole fruit. 3. Chronic dehydration. Most adults are mildly dehydrated most of the time, especially older adults whose thirst mechanism becomes less sensitive with age. Your urine should be pale yellow. Dark yellow or amber means you need more water. The fruits we discussed today all contribute to hydration, which is part of why they help. 4. NSAIDs, ibuprofen, naproxen. These common pain relievers reduce blood flow to the kidneys. Chronic use is a significant and underappreciated cause of kidney damage. If you're taking these regularly for pain, please discuss alternatives with your doctor. Okay, let's recap. 7 fruits, each one with a different and specific mechanism of protection. Cranberries, prevent the infections that silently damage your kidneys. Watermelon, improves blood flow and delivers citrulline and lycopene. Blueberries, the antioxidant and anti-inflammatory powerhouse. Apples, pectin-based gut toxin removal and quercetin protection. Lemons, citrate to prevent and dissolve kidney stones. Strawberries, ellagic acid, blood pressure support, and vitamin C. Pineapple, bromelain to fight the inflammation that drives CKD progression. None of these cost a fortune. None require a prescription. They're all available at your grocery store right now. The research doesn't promise miracles, but it does clearly show that consistent, long-term consumption of these foods creates an internal environment where your kidneys can do their job more effectively, with less damage for longer. That is worth a lot. If this video was helpful to you, please hit the like button. It genuinely helps this channel reach people who need this information. Subscribe if you haven't already, and share this with someone you love who could benefit. In the next video, I'm going to cover the 5 drinks that kidney specialists say their own patients should be consuming, and a couple of them will probably surprise you. I'll see you there. Take care of yourself.